We are going to do a quick segment on candidiasis, and we are discussing white lesions. So first off, we have three main types that I want you to focus on here. We have pseudomembranous, which is also called thrush. Okay, we have central papillary atrophy, also called median rhomboid glossitis, and angular colitis. So first off, our pseudomembranous is going to appear creamy white. Okay, there'll be plaques that are removable. Okay, so removable plaques. There'll be a burning sensation as well as a foul taste. Now, it will be appearing mostly on the buccal mucosa, the tongue, and the palate. Your contributing factors are going to be antibiotic therapy as well as immunosuppression. Now, next we have central papillary atrophy or median rhomboid glossitis. Now, this